Hi everyone. So this video of mine is a continuation of my previous video wherein I was discussing about what actually you mean by space maintainer and why do you need a space maintainer, what is the best space maintainer. So all that you will find in my previous video. I'll put the link in the description box of that video. Then today, continuing that same thing about space maintainers, we'll discuss about the various types of space maintainers. Okay. Now, what kind of space maintainer will be required where will actually be decided by the area or the kind of tooth that has been lost. Now, let's say when the lower or the upper incisors are lost, primary incisors, that is the milk teeth that I'm talking about. Or let's say, or in a layman term, if I say, if the lower or upper front teeth are lost, then in that case you can use a kind of space maintainer that's called as the Hollywood bridge, wherein you have artificial teeth in that lost region, and I mean the region where the teeth have been lost. So as you can see in the picture also, behind those artificial teeth you will have a wire that is soldered onto them, and that entire thing is soldered to the stainless steel cap, and that cap is cemented onto the primary or the milk molars. So obviously it's a fixed kind of a space maintainer, fixed in the sense that patient will not be able to remove it, but your doctor will be able to remove it. So that is the first kind, that is the Hollywood bridge. So it's used in the front region, upper or lower. Then we have a very common kind of space maintainer, that's the band and loop space maintainer. See, band and loop. There's a band, and together with that band, you have a loop sort of a thing, which is again made up of stainless steel, and that loop is soldered onto the band, and that entire thing is cemented onto the molars. Now, again, most commonly you will see that this band and loop kind of space maintainer is cemented on the molars, the primary molars. It can even be used to preserve the space in the permanent tooth also. Like you can also use it to preserve the space of premolars. So that means you can use it on the permanent molars also. Whichever way, the idea is to preserve the space for one tooth, that is a single tooth, and it can be used anywhere in the mouth. The location of it is not a limitation. So wherever you find it convenient to use, you can use it. Then there's a modification to that band and loop space maintainer which we studied, is this, that's called as the crown and arm space maintainer. Now instead of that loop that I showed you in the previous picture, there's one loop, right? Like on the right picture, on the right side also, you can see there are both kinds. There's the band and loop, the conventional band and loop space maintainer, and the crown and arm space maintainer on the left hand side of that same picture. So whichever way, you can, instead of forming a loop, you can modify it to just one arm, right? It will not be a closed loop. You can either leave it just as like straight line in the form of arm, or you can even move it around the tooth structure. Whichever way, depends on the dentist, depends on your doctor. Then again, a Gerber type or the distal shoe extension, this is also a kind of space maintainer. And this space maintainer, the concept of it is originally derived from band and loop only, because again, instead of band you have the stainless steel, and instead of loop you have this stainless steel extension, right? That's called as the distal shoe, and this distal shoe is going deep inside. That means it is going inside the socket. So the purpose behind replacing that band with a stainless steel cap is that it provides better anchorage, right? It will be more firm. And the concept behind having a distal shoe extension deep inside is that first, it preserves the space, yes. The second is it also helps in eruption guidance. Okay, now what do you mean by eruption guidance? See, eruption guidance, as you can understand by the name itself, it guides the eruption. Guides the eruption of what? Of the tooth that is yet to erupt, of the tooth whose space is being preserved. Now see that distal shoe, it is extending inside the soft tissue. In layman terms, it's extending inside the gums. So I hope you can see that small premolar, second premolar tooth bud that is yet to erupt, and the second primary molar has been lost. So to preserve the space of the premolar that is yet to come, and also to guide it into erupting into its actual position, a distal shoe extension is required. So eruption guidance is basically, it is guiding the unerupted tooth to erupt in its appropriate position. Okay, that's it. There are many more space maintainers. It's very difficult to cover all of them in just one video. I'll cover the rest of them in my coming video, in my next video. Till then, take care. Thank you.